Most people who are infertile are actually not truly sterile, they are just subfertile. In other words, they've had more difficulty than average getting pregnant. It's a very significant condition affecting about 1 in 6 couples in Australia, and we know that the rates of infertility are on a steep rise.
There are a lot of things that we don't know about the causes for infertility. Some might be hormonal, some might be developmental, which is what I focus primarily. We don't know what the genes are involved in these conditions. We don't know if there is an interaction between the environment and our genetic makeup. There are a lot of things that we need to figure out to try to find some answers that these women deserve.
One of the most common causes of infertility in Australia, particularly for women, is ageing, because egg quality declines so much over time, and a lot of women are waiting until later in life to start their families.
The WHO clearly states that, because of the psychological distress and suffering it causes, that it is a critical condition. Be that as it may, infertility still remains, and there are not many units that actually have a dedicated fertility research theme. So CCR is very unique in that respect, and you won't find the expertise that we have in our lab anywhere else in Australia.
In order to understand why it might not happen properly, we need to understand more about how that process actually happens in an ideal situation, so that we can then identify where it's gone wrong and why it's gone wrong.
What we aim for is to improve the diagnosis and the clinical management of these conditions affecting development. It will be very interesting to try to find an answer to how genetic factors interacts with the environmental factors. I believe this information will be very empowering for them as well.
So the holy grail of reproductive medicine really is to be able to improve egg quality. So that's what our lab is set up to do, specifically investigate this very hard to study cell type, but one that is absolutely critical to pregnancy success.